Hi, I'm Ria.
Hi, I'm Haley, and together we are
Chronicles of a Spoonie,
sharing stories.
creating connections.
I'm really excited for this one today. We actually have Claire coming in to discuss endometriosis.
And I'm really excited because I've heard your story and I'm looking forward to hearing it from another perspective.
Yeah, likewise. And I think it's going to be really an interesting one. And I think I'm going to learn things from this as well. So before we get Claire in here, we do just as always want to give trigger warnings for today. So there will be mention of breast cancer. We'll also be discussing contraceptives. There will be quite a lot of talk about fertility as well, and some medical distress. So just take note if any of those are certain triggers to you. Maybe give this one a miss, and you can come back for our next one. But that being said, let's speak to Claire.
Let's do it. So today we have Claire with us. Claire, would you like to introduce yourself?
I would, thank you, Ria. So I'm Claire. I work as a category manager. I absolutely love my job, but it can be really stressful, and lots of people don't even know what that entails. Won't go into it, it's such a long story. I live just outside Manchester with my 16-month-old puppy. She's a Rhodesian Ridgeback called Nala. She keeps me busy, she keeps me on my toes, and she helps to motivate and get me out of the house.
You got to be thankful for dogs for that. I mean, they love us so unconditionally, and ask for nothing in return, and you can literally do anything to them and they will still love you so deeply, and yet they do so much for us and they don't understand it.
Mm-hmm.
Yeah, absolutely.
So when was the first time that you knew something was going on?
So the first time that I knew that something wasn't right was from a very young age. So I was quite young when things first started to go wrong. It was from the very early age of probably about 12 years old, believe it or not. So my first cycle, and obviously it's always a little bit unknown when you first start. It's very irregular and painful, and that's when I knew something wasn't right. I kind of went through the first, second and third cycle, but from a very early age. I was approaching my GP to say something doesn't seem right. My mum was there to support and say something's definitely not right with her, just due to the irregularity and the pain that was coming with it straight away from the very first period.
It's wonderful to hear though that your mother was there supporting you by your side. So many mums in the beginning periods are like, it's what it's like, or it's your first few periods that can be like that, and it's not that they're dismissing it, it's just they're trying to, I think, calm you down. So it's wonderful to hear that your mum was just listening to you and going, okay, if this is what you need to do, then this is what we'll do. What was the doctor's reaction, may I ask?
Just to add another point to that, my mum was so supportive because my mum had endometriosis.
That was going to be my next question.
Yeah. So the doctor's initial reaction was, we need to give you pain treatment. We need to give you painkillers that are stronger than paracetamol, but not anything that's too, mainstream. Tried that for a while. Probably about 3 months later, I think it was, when we realised this is just not working. The pain relief is not working, and I can remember very clearly what those tablets look like, and it wasn't working. It wasn't helping. Nothing was helping with that pain, and it got to the point where actually I was missing a lot of school from such a young age, and it was affecting my school, and I was, sometimes I would be on a 3-week cycle with 1 week off, so it was really taking a lot out of my school time as well.
Yeah. And so is that something that they didn't sort of suspect early on, given that your mum had it and she knew that she had it? Was that not something they even thought about?
No, it wasn't even really referenced. It was a couple of years after that when she got diagnosed properly and had
Right,
to
okay.
have a full hysterectomy. But they did know at the point that I was struggling that she had endometriosis. However, she had been sterilised, and they said that's where that was coming from.
Right.
Upon further investigation, it actually turns out that my mum's mum also had problems. And it seems like maybe there's something there in the genetics, because that's not proven, but it is suspected that it can be
Yes.
hereditary.
Yeah, I know that's one of the things they talk about is, well, from speaking with my doctors, they said that it may well be genetic, but because it's actually so common, they can't determine whether it's genetic or just coincidence that a lot of families tend to have it in the genetics. They don't know if it's hereditary or not. It blows my mind that given it's so common, it should be easy to determine whether it's genetic or not. But yeah, I mean, that's crazy. Three generations of women in your family that all have had it, and it took you so long to get the diagnosis.
Yeah. When I went back to the doctors about the pain relief not working, their answer was, then we need to put you on the contraceptive pill. And I was a 12-year-old girl who had it in her mind that everybody would know that I was taking this.
Yes.
And, you know, it was such a stressful, traumatic experience for me at the time that I just refused point blank to take it. I was like, I will suffer, things will improve, things will get better. And again, at this time, people didn't know that much about endometriosis. I know my mum had it, but they thought it came from another procedure that she had done. So it wasn't like there was like, you didn't put 2 and 2 together and come up with 4. It was like that she'd got that because of something else that she'd had done, and I hadn't had that done. So why would it be the same thing? Eventually, after probably another couple of years of suffering, another couple of years of suffering, I did end up going back to the doctors for the pill specifically, but I was in and out of the doctor's surgery trying to get more support to manage the pain. So I think I was probably around 14, 15 when I first went on the contraceptive pill. And at the beginning it helped. It kind of regulated things. It definitely stopped the cycle being 3 weeks long, which was a godsend in itself. So the problem that I found with the pill was it doesn't fix it, it masks it.
Yeah.
And when you get a little bit of relief from one of the symptoms that's really causing you problems, you kind of accept that that's a little bit better now and you can deal with it. So because it had kind of stopped the 3-week cycle and it was only a week that I had to endure it, that for me was the best thing ever.
Heaven.
Yeah.
Definitely.
It's a thing with things like that, and even with painkillers for all chronic illnesses, is all it's doing is masking. Why aren't we looking into why we need that pain relief? Why aren't we looking into solving that problem so the pain relief is not needed? We should be looking into it, not masking it. And with endo, it is definitely something that we hear a lot about, is pain relief. And some others struggle to even get that.
Yeah. And I think with the pill, it's clearly with your story, Claire, it's just, I've heard it so many times that it's just throw a plaster at it and give people the pill, and don't really actually teach everybody what the pill does, how it can affect you, and the other side effects and symptoms you can get from the pill. Because you can maybe mask a little bit of your pain, but you could be introducing a whole host of other side effects that you don't get told about beforehand. And that can have a whole other different type of impact on your life, and it becomes a case of substituting one for another.
Yeah.
Whilst it masked a few things, it also does as much damage as it does good, because endometriosis is driven by hormones, and the more hormones that you pump into your body, the more chance it's got of spreading, growing, making it worse.
Exactly.
So you're 14 years old, you are on the pill.
Mhm.
How long was you on the pill before a next step was required, before they tried something else?
Believe it or not, and this might come as a shock to some people, and this is probably the most disturbing part of this story, because I was told it was perfectly normal. People do get heavy, painful cycles. I stayed on the pill until I was 29 years old. I was led to believe it was just one of those things. It was normal.
You'd been on the pill for half your life at that point.
Yes.
Just to put this out there, me and Haley went quiet because our mouths just were wide open, like gobsmacked.
Yeah. So I think as much as, you know, the NHS are fantastic, and I want to touch on that more. The fact that the first kind of interaction at such a young age with the doctors were, it's normal, it's a period, get over it kind of approach. I just did that.
Yeah.
And I just dealt with it, and I stopped going back to the doctors because the pill was dealing with most of the problems. It made it almost manageable. With the pill, there are other risks as well. There are other health risks. And, you know, I made the decision at the age of 28, 29 to come off the pill, and just see how things went.
Yeah. And was there the sort of decisive factor that made you decide to come off it at that point? Like, was it the case of the symptoms had become too much from it, or was it just that you wanted to see how your body was off it because it had been that long?
I wanted to see how my body was off it because it had been that long. But I'm also very conscious of the fact that we have a lot of problems in our family with the women. And my maternal grandmother passed away from breast cancer at a very early age. She fought it the first time and it got her the second time. And obviously there's heightened risks of that with hormone treatment. So because I'd been on it for so long, I kind of took the decision to say, I'm going to come off this now and see how my body deals with it, and see if anything's changed.
Yeah.
And had anything changed?
No, unfortunately not. That's when things really started to spiral. So when I came off the pill, things started to become problematic. You know, the cycles got worse, they got irregular again, extremely, extremely painful, excruciating pain. And it was only, I kind of dealt with that because one of the things that I think is difficult, and one of the things that I want to stress to anybody who's listening about this, is any pain that you think is not acceptable at any one time, you need to go and get it checked. You need to go and speak to your GP, and you need to fight for that exposure. Because what I found was happening was it was once a month. And by the time it came round again, you forgot how bad it was last time. Is it getting worse? Is it getting better? Is it the same? You don't know. So as soon as you find yourself in that position, go and get it checked out, go and fight your corner, go and speak to your GP and try and get some support and say something's not right. Like I said, because the cycles are so far apart and you get such relief when it ends and you're not in as much pain as you were, it's hard to compare from 1 month to the next how good or bad you are.
Yeah. So just since you'd come off the pill at that point, could you talk us through a bit about what your symptoms were that made sort of alarm bells start ringing that something really wasn't right again? Was it mainly the heavy periods, or what else happened for you each month that really you couldn't live with because it's just pure agony?
there was a couple, it was heavy periods, but what really tipped me over the edge was I got to a point when I was 31. So this is 2 years later again. So
Wow.
I suffered that for 2 years. I got to a point when I was 31 where I couldn't sleep through the night. I was up 2 or 3 times a night, usually at the same times. So something was happening that happened religiously each day. And this wasn't even during a cycle. This was between cycles. And I would be pacing the floor in pain. I would be rocking in bed. You know, I'd be doing anything possible, getting in any position possible. 9 times out of 10, it would be on all fours on the floor, in like a frog position, just to try and alleviate some of the pain and some of the pressure. And that was happening most nights, cycle or no cycle. So that was the point where I said to my mum, enough is enough. I have to go to A&E and I have to go now.
Yeah, that's a hell of a lot to be going through on essentially a daily basis with no relief.
For me, you're like, to actually sit with and discuss the second person, but to hear on social media, because it's now becoming a thing. I don't know if you know this, Amy Schumer has come out with saying she's got endometriosis and is trying to raise awareness. And the bit that interests me from each of your stories is how you deal with the pain, because it's so similar. You don't know each other. You know, we're just actually sitting down with you for the first time. So Haley's never sat with you and discussed it. Amy Schumer definitely doesn't know either of you, and she does. Why don't I know this?
She's my bestie. I can call her now if you want.
But it is interesting to me that the pain relief angle seems to be similar, all fours.
Yeah.
But does that not remind you of giving birth? A lot of people giving birth end up on all fours at one point because it's such a good pain relief angle to be on.
Yeah. It's because gravity. Because when you're on all fours, it's gravity. So it's trying to do something to try and relax those pelvic floor muscles, because everything is just scrunched up. Everything is as tight as it can be, because in response, your muscles just spasm. Your muscles are just trying to do what they can to deal with the pain, and they just tighten and tighten. And the only way to try and get some relief is try and let gravity do something with that and help pull everything down a bit, because everything is so scrunched.
Yeah, it is like somebody's squeezing something from the inside. It's like, yeah, it's such a weird kind of pain to explain. And the most peculiar thing for me is I can't explain the pain, but I can tell you if I'm in pain in my abdominal area, I know that that's endometriosis pain because it has a distinctive kind of feel to it.
Yeah, I know it's something in my podcast whenever you asked me, Ria, about, you know, can you describe the pain? And I think I just described every type of pain that you can have. I described sharp and stabbing and dull and aching and crampy, and because it comes in all of those forms, depending on whether it's adhesions that are pulling, whether it's you're cramping and you can actually feel contraction sort of pain, whether it's, you know, it just completely depends on what part of your body. But like you say, Claire, you know, you're like, oh, that's endo pain.
You said a minute ago that you ended up going to A&E, not GP, to A&E.
Yeah.
So what happened there? Like when you got to A&E?
This is the bit that's going to probably trigger some mixed emotions from people. So I went to A&E and I was triaged by a nurse who was not very pleasant. I told her about the symptoms. She suspected I had irritable bowel syndrome, which is what everybody gets told, and said to me, well, they're not going to do anything for you. You'll have to wait and get a referral from your GP, and sent me back out into the waiting room. So she triaged me and still wanted me to see a doctor, but told me there was nothing the doctor was going to do. I had to wait for a referral from my GP because it was IBS.
That must have been soul destroying. Before you went to see the doctor, to have a nurse tell you that, hey, they're not going to do anything for you.
Yeah, it was. Because at this point I was still doubled over in pain. It was getting to the point where when you're on the floor and you're trying to release some of that pressure that you're feeling, it does take your ability to walk away.
Yeah.
So I'd hobbled into A&E for this nurse to tell me, they're not going to do anything for you, but you can still sit here.
Did you listen to that IBS thing that, I don't even know what to call it, flippant comment from the nurse?
No, I knew at that point, deep down inside, I think the 2 years that I came off the pill, between that time of coming off the pill and going to the A&E, deep down inside I knew it was endometriosis because I'd seen my mum go through it. But again, you kind of say to yourself, you've seen the symptoms, are you looking for it to be that? Are you looking for that because it's an answer?
Right.
This is where the conversation about the NHS turns a little bit more positive.
Okay.
So whilst I was in A&E for well over 8 hours before I got a bed, it was by pure luck that I got a female doctor who knew the signs of endometriosis. She laid me on a bed, pushed on my tummy, saw where it was painful. At this point, it was 4 o'clock in the afternoon and the scanning department was about to close. And she said, I need you to go now for a scan before they close. I need you today. And that's exactly what happened. I'd been there from about 2 o'clock and the doctor said, go for the scan. Went for the scan at about 4 o'clock. They had the results back pretty quickly. She took me back through to A&E and fitted me with my very own pretty hospital bracelet and said, you're not going home tonight, Claire. You're staying here. And I was admitted to the women's hospital that day. However, they didn't have a bed for me. They're completely overrun. They're completely understaffed. And it wasn't until 10 o'clock that night that I got a bed. So I had to sit in pain in an uncomfortable chair in A&E, waiting for a bed on the ward to come available.
Wow.
Just a quick question. Did you see the triage nurse again?
No.
Darn it.
Kind of wish I had.
Yeah.
I'm not being funny, but it would have been good if you had, and you'd said to her, listen, I understand that how it looked to you, but I came in here in extreme pain.
Yeah.
If not just to be helped with that, to be eased, to have you sit there and basically mock me for coming in.
And also make a diagnosis that she doesn't, well, assume that you're probably going to get a diagnosis that she doesn't have the right to either make or suggest.
Yeah.
One of the things that it's very, talking about the NHS, that I talk about quite a lot, is a lot of nurses lose their compassion during their job, and it's not their fault. It really isn't. It's the patients that give them attitude and tear them down until they've got nothing left to give.
Yeah.
I get asked quite a lot by student nurses, as a patient for many, many years in the NHS hospitals, what's the one bit of advice you can give us? Nice. It's always, no matter what's thrown at you by patients, try not to lose your compassion, because once you lose that, you're not doing your job anymore. You know, you're not making your patient feel cared for. Yes, you're probably a really damn good nurse. You're probably really bloody good at it. But for the patient, if you haven't given them compassion, if you're not listening to them when they're talking to you anymore, that's worse than anything else.
Yeah.
Because it really is. She didn't listen to you. She didn't give you no compassion. For the bits that she does know, you are in pain. A lot of it. That should have been enough for her to say, we will get someone to you to give you some relief. Not well, you need to go back to your GP and get a referral. They're probably going to diagnose you with IBS. Like, no, sweetheart.
And I think they become so desensitized to it, because at the end of the day, the A&E is their job. Specifically in this case, it was A&E was her job, and she sees that day in, day out, and she says everybody day in, day out. And yes, we all know that there are time wasters out there and people who shouldn't be in A&E, but whenever the majority of people go to A&E, it's because they are at breaking point and they don't know what else to do or where else to turn, or they're in so much agony they need care right now. And to just be treated like you were there wasting time, whenever all your life with symptoms of endo, you're told that it's nothing to worry about, and it's in your head and it's just this, you're just unlucky. To then have that reaffirmed by a triage nurse as your first point of contact in A&E when you can't cope anymore, that's too much. That's soul destroying.
Yeah, it was difficult to hear. It was very difficult to hear, because she could see that physically my walking was not where it should be. It was very difficult to walk. And you're right, Ria, it's about that compassion. I mean, what she didn't know, and what she would never be able to know, is I stopped going to the doctor because it was just one of those things you had to get on with, and I masked over it with the pill for so long. I'd never been in hospital. I rarely went to the doctors. It was a very upsetting and traumatic experience in general. It was frightening, wondering what's going on, what they're going to find. I need to go and tell them my life story. And you're right, that little bit of compassion would have probably eased my anxiety, I guess I should really call it, at the thought of being in A&E in general.
Yeah. Or instead you sat in that waiting room feeling like you shouldn't be there, and you're about to be probably mocked, or you're wasting our time, or it's not necessary. And it could have been a really long shift, because she could have been towards the end of it. 4 o'clock, probably not, unless she's part-time, but it doesn't excuse it. Each patient is different,
What benefit does it provide to her or to you? What did that actually achieve for her or for you? That it was of no benefit to anybody?
Yeah, you're definitely right when you said this part was going to be triggering. For sure. So you've been admitted, bed at 10 p.m.
Yeah.
What's next?
So next, the doctor comes round in the middle of the night, because they'd had some emergencies that came through. I get examined at 4 a.m, something like that. And they do all the usual tests that they need to do. And he says that there'll be a consultant that comes round to see me the next morning. So I take myself back to the bed. The consultant comes round first thing in the morning, about 8 a.m. And at the time, it felt a little deflating, because it felt a little dismissive. He said, "Are you in a lot of pain now?" And I said, "No," because I wasn't at the time. And he said, "Okay, we don't think you're an emergency, so we're going to treat you as an outpatient. We're going to order for you to go for an MRI scan, because the one that I had before was CT scan. It does look like you've got something on your ovaries. It looks like you have cysts. So we're going to get an MRI scan done so that we can see properly, and we'll take it from there." At the time, that was a little deflating, because I could have been in my own bed comfortable to find that out the next morning. But they were doing what they needed to do. And in hindsight, looking back, it was the right thing. And again, I got very lucky. And this is where the story turns a little bit more positive with the NHS. By pure luck, I ended up in a hospital that I wouldn't have normally have gone to. And it turns out I was under one of the most experienced endometriosis surgeons in the UK.
Wow.
It was just
Incredible.
by pure luck. So all of that ordeal to get there was really unfortunate, and it's a really big negative to put on the NHS. But actually, once you get to the right place, once they listen and you get to the right people, it turns out better. It comes good in the end.
Yeah, it's getting to those right people. As you say, it's the hard bit, and it shouldn't be so hard. Once you get to the people that know your condition and know what to look for, that's when you're going to start to see progress.
Yes.
But until you can get yourself there, it's a bloody battle. It really is.
It is.
So at this point, you're 31.
So I'm 31. This was in the February or March. This was in the February. So we had the MRI scan within about 6 weeks, a follow-up appointment within a couple of weeks with the consultant, who confirmed that he all but said, you are riddled with endometriosis.
Wow.
I had 7 centimetre cysts on my ovaries, both sides. And just to put that into perspective for anybody that might not know, the average size of an ovary is about 3 to 3.5 centimetres.
So do you have polycystic ovaries as well?
No, they were all just cysts full of endometriosis.
Were they chocolate cysts? I know they sometimes call them that because of what's inside them.
Yeah.
Chocolate cysts?
Chocolate cysts. It's the type of blood inside them, is the colour and consistency of chocolate.
That's something new today.
Yeah, so yeah, you're absolutely right, Hayley. 2 chocolate cysts, 1 on each side. And I have to joke about it, so at least I was even. Lots of endometriosis around my womb, fluid in fallopian tubes, lots of smaller endometriosis lesions in my pelvis, which was probably not helping with the walking. The consultant said, you need to have a laparoscopy. We are pretty confident that you have got all of this endometriosis, but the only surefire way to guarantee that's what it is to go in there and do a laparoscopy. We can see the cysts on the MRI because it's such a mass, but the only way to guarantee and double check if it's endometriosis is to go in there and have a laparoscopy.
No wonder you were in agony.
Just to clarify for those who don't know, can you explain what a laparoscopy is?
Yeah, absolutely. So essentially what happens is, this is first and foremost, they try and do keyhole surgery, and they go in there with, they go in through the belly button, and also wherever they need to be. They also make incisions there. They'll go in with a camera, and also with a little kind of laser to burn some of the endometriosis away, but they'll go in with the camera, have a good look around, and then try and take as much of it as possible away.
Did they get to take much of yours away?
Yes, so they managed to remove both cysts without damaging my ovaries too much. That's always a risk. They also managed to drain the fluid on the fallopian tube. They cut a lot of endometriosis away and managed to get the majority of it out of my pelvis, but it's stuck to different areas. And I guess if you imagine the crystal maze globe at the end where all the money's flying around, you can't catch it all, you can't get it all, and some of it's so tiny that there were still a few bits left in there. And this is, I believe, one of the reasons why they say there is no cure, because while ever your hormones are going on and there's tiny, tiny, tiny little speck of it, even, smaller than a millimeter, it can grow and come back.
Mm-hmm.
It's a fascinating illness, isn't it?
So once you had this laparoscopy and they're in recovery and you've been told all about it and everything, did you, well, first of all, how long did it take recovery for you? Because that's quite extensive with the drainage of the fallopian tubes and the cysts being cut away and all of the other internal trauma, essentially, because that's what it is, because it's trauma to your body having surgery. So how long was it for you that it took for you to recover?
So I was in hospital overnight. I was supposed to be, the doctor said, the surgery is normally about 45 minutes, but you do have what we believe to be an extreme case. So we're going to put you in for an hour and a half. It was probably about 4 hours later that I came back. Obviously the operation was at 4 hours, but going down, going into theatre, coming into recovery and getting back to my bed was about 4 hours in total, 3.5 maybe. So they kept me in overnight because it was quite a long procedure and I had to have drains and things like that. I did manage to go home the next day, and everything was fine. I had to just, take it easy. And I took it easy for probably about 3 weeks before I really did anything properly for myself. After 3 weeks, I stayed with my parents, and after 3 weeks, I came home. And I think that really was most of the recovery time from a physical standpoint.
Did you have a follow-up then with your consultant and things after the surgery too?
Yep. So the follow-up was about 4 weeks after the surgery. And the follow-up was he told me how the surgery went again, talked me through what had happened, what they'd found, the fact that it was quite an extreme case, and then gave me my options with regards to follow-up treatment. Initially, I had not a great deal of choice, really. It was either don't do anything, but it's going to come back because there are bits in your pelvis that we couldn't get, or you start to go on the injections to close everything down and induce an early menopause.
That has to be a tough decision to make, especially when you're so young.
It was, and actually he said, it is your decision to make, but I don't think you can leave it. I think you have to go on the injections because your ovaries have been through so much trauma during the operation that they need a rest. They need to recover. They need to stop functioning normally.
So, and don't answer if this is too personal, but that would mean no children, or had you already had children? I don't know.
No, I don't have any children. They don't know right now whether or not I will be able to have children. Endometriosis can affect your fertility, can make it harder, can make it impossible. You can come out of having treatment and laparoscopies and be absolutely fine.
But if you were to have the injections to bring on menopause, would that stop? That would stop the ability, no? Or is that still a possibility?
No, it is still a possibility, and you'll never know until you try.
Okay.
It is only a temporary state. So I am still on the injection treatments.
Okay, so that's what you picked.
Yeah, we're now 3 years down the line, and I'm still on the injection treatment.
Ooh, okay. So I'm interested in that because I was on those same injections, and I was on them for 6 months. But they had told me that the maximum really amount of time was 12-month periods. So I'm interested to see how that's worked for you being on them longer than that?
Yeah, so it doesn't come without its challenges. Some of the things that you touched on, the side effects of that, you are in a menopausal state, 11 o'clock every night without fail. I will have a hot flush. You can set your watch by it. Weight gain is problematic. One of the things that I did was I requested, because I knew I was going to be on it for longer, I requested to go on to the injection that's a higher dose, so it lasts for 3 months rather than 1 month.
Right.
Because what I was finding was at the beginning of the injection, you would have more hot flushes, and then towards the end, because it's kind of fading out and your body wants to start to kick your own hormones back in, and you're taking HRT, you get an overspill of emotion, and it's very much like going through puberty again. You get quite spotty and really poor skin. So to try and smooth out those peaks, instead of it happening every single month, I requested to go on to the 3-monthly injection.
Right. Interesting. And then do you have regular follow-ups and things on those?
Yep. So my follow-ups are 6 monthly, and I'll be 3 years. It's 2.5 years at the moment, but I'll be 3 years on it in July. And this is the point where on my last follow-up, my consultant was saying, you definitely need a rest from this hormone treatment. But again, going back to one of the things that you said, Hayley, because I have listened to your podcast, each time I have a consultation, the first question that they ask me is, are you ready to start trying to have a family yet?
Yeah. It's definitely one of the, I understand why they ask it, but that shouldn't be the option put out, because first of all, you should have a baby when you want to have a baby, when you are mentally, physically, financially secure and ready to have a baby, not as a treatment to a disease.
Yeah.
I understand why, because of what it can do, but that's not a definite. It's not, this is a cure. Have a baby and put yourself in 18 years plus of financial ruin if you're not ready for it or emotionally ready for it. And that's both not on you or the kid, but there's no guarantee it's going to work.
No, and one of the things, it is a long commitment to have a child, and there's nothing more triggering when you're sat in that room when you're undecided whether you want a child, and then somebody says you've got a disease that might mean you can't.
Yep.
There's nothing that hits home harder than that, because that's the second that the realization hits you that if you're telling me I can't have it, I probably do want it.
Yeah.
So yeah, it's the treatment at the moment, I think, is going to have to change. I have another appointment with my consultant in April, and that's when I'll find out what the next steps are. One of the things with pregnancy as a solution is living with endometriosis, and just knowing that it causes so many problems to simple daily tasks. Trying to care for a child when your hormones are going to start to kick back in, and you might be able to start back up with endometriosis, and having the symptoms of that and caring for a young baby, I think it's a dangerous suggestion to make for any woman.
Yeah. And you've made the point perfectly. It shouldn't be something that you feel like you have to do to try and alleviate your symptoms, or because a doctor thinks that you should, or you have to do it now, or otherwise you might not get a chance. And if you don't start trying now, it might be too late by the time you realize you can't. All these kind of things go through your head where you're, like you said, when you're told you potentially can't, makes you want it more.
Yeah.
And it's a weird psychology thing, isn't it, that you just I don't know, it's a strange one, because until you're in that situation, in that room where you're told that, it triggers something it just triggers something kind of primal in you, where you go, my body clock's ticking.
Yeah.
And I might actually not even have a body clock, because my body might not work the way I need it to work.
Yeah.
So I totally get that.
The problem is by the time they make you think about it, by the time it's in your head that you want a baby, there is now the option that it might not be an option. It is now a possibility that you won't be able to have kids. And that's another part with the mental health. It's gonna knock you for six. It's not bad that you suffer enough with pain, and pain is the biggest drainer for mental health. It drains you mentally, and it causes depression. You've now got, can I have the kid? And if I can't have the kid that I didn't even think about prior, but now you've put it in my head, now I want it, and now I can't have it. It's soul destroying. It should never be an option for fixing a disease. It should never be brought up.
Exactly. And I know we said that we're not 100% certain on whether endo is hereditary or not, but you're also potentially passing that on to, if you have a daughter, you're potentially passing that on as well. And I know for a lot of women with endometriosis, that is something they think about before they have a child, is, do I want to pass this on potentially to my daughter? Because we know what it's like to go through, and we don't want to inflict that on somebody else. So that's another thing that you have to consider, plus the people who might not even want to have kids at all. And there's already stigmas around women who don't want to have kids and have made that choice for themselves not to have kids, and to then push on the fact that, you might never be able to have one, or this could be used to help your symptoms. For somebody who is deadpan, they don't want children, that's not fair either. And I know we haven't really touched too much. I know you mentioned your mum had a hysterectomy, didn't she, Claire?
Hysterectomy, so everything.
She had everything out. So my mum, she had a hysterectomy as well. And that's the other thing, that you've probably been through the same thing when you've been into the doctor and they mention to you, later down the line, a hysterectomy could be an option for you. But then they go, do you want kids? And you sort of sit and think to yourself, if I said no and I pushed hard enough, I probably could get a hysterectomy now. And people don't really tell you enough that hysterectomy also isn't a cure. You're making a permanent life-altering change to your body, removing an organ or organs. And it's not 100% a cure. And it's solidifying the fact that if you change your mind 10 years down the line, you could maybe decide you want kids.
I think that's one of the main reasons why my consultant, because as I said, he is very, very good. And I think that's one of the main reasons why he's trying to keep me on the treatment, to try and keep things at bay, so that he can preserve my womb and my ovaries in case, I do want to have a family at some point. It's not possible for me right now. But, it's always a topic of conversation every time that we speak to him. And I don't think he's necessarily trying to labour that point. He needs to know where I'm at.
Yeah.
And there isn't like an infinite amount of time to be able to have a family or start a family or try and have children. One of the things that they have said is that because of the situation, because of the treatment and everything, if I was to start to try and have a family, they would want me to get pregnant as quickly as possible, so that the endometriosis has got less time to come back and start affecting things again. So they have put like a mini plan in place to say, we will do this, then we'll time it from your first cycle, and if it's not really happening within 12 months, and we'll give you as much support as possible, but if it's not happening within 12 months, we'll get you in for testing and look at possible other routes. So they have done a lot of stuff, and are doing a lot of stuff to try and support wherever possible in that making of a family.
Yeah, I mean, that's a good flip side there actually as well. If you do want children, and it's nice to know that you do have support there, somebody you can speak to, and they can put plans like that in place and inform you of how the process would work. So on the flip side, that is a positive. I guess it just depends on where you are and what your plans are over the next year or two. whether or not you find that beneficial. But I get at the end of the day, the doctors have a duty of care, and they also need to make sure that they're making the right call based on what you want. So sometimes I guess they do have to ask those tricky questions that nobody necessarily wants to hear. I wanted to go back to just whenever, I know you mentioned you started the Zoladex. I'm assuming it was Zoladex. I know we just called them injections, but did you start those after the surgery then? You weren't on them before?
Yeah. Yes, they timed my first Zoladex injection was done through the hospital 4 weeks after my surgery. That was the first time that
right. And have they given you, obviously you've been on them for coming up in 3 years now, have they given you relief? And has your surgery given you relief? I guess it's kind of hard to distinguish the two because you've been on the Zoladex since you had your surgery, really.
Yeah, so yes, it gave me relief for complete pain relief for about 18 months in total.
Incredible.
It was amazing. I was like a new woman. It didn't come without its challenges. And when I say that, the emotional side, because it's messing with your hormones, one thing that may make you smile is after my first injection, I wanted a bacon sandwich. It was about 2 days after I wanted a bacon sandwich. I went to the fridge, there was no bacon, so I stood and cried. It's the worst thing I've ever cried over, but that is the kind of effect that we have to be aware of when we're talking about these treatments. It's hormone treatment. It makes you imbalanced. So I didn't return to work straight after my recovery, my physical recovery, and that's what I alluded to earlier. I took an extra 4 weeks off just to get my emotions and my hormones in check and deal with the imbalance that I had and try and settle into a routine with the medication before I went back to work. Because, as I said at the beginning, I do have a stressful job. I love it. But that on top of the ordeal of the operation, everything that's going on, the confirmation of the diagnosis, and then hormone treatment on the back of it, it was a recipe for disaster.
Goodness gracious me.
Yeah.
Sounds a lot like pregnancy. I know a friend that went to the fridge to get a cup of tea. There was no milk, and she stood there and cried. She couldn't stop crying until her husband brought some milk. The hormones just affect you in a certain way, and it sounds a lot similar to them, except for you don't get something wonderful at the end.
Yeah.
The question I had is, what people don't know is we've had a break. We had a little bit of a conversation in the break about people you know with it and conversations you've had with it. My question is, having had conversations with other people that have gone through similar things or understand endometriosis, have you found that all your stories are very similar or the same, or there is actually some variation?
In the main, what I have found is very similar stories. Most things that, when we were talking earlier and I mentioned certain things, Hayley, laughed or kind of scoffed a little bit, because you hear the same things from people who have gone through this process. You hear that you've got IBS. You hear that it's normal. You hear that have a baby, it'll fix things. All of that sort of stuff. Some stories do slightly vary. I think the average diagnosis time is about 8 years, and that varies how people get diagnosed and why it takes 8 years. My story is very much I didn't fight hard enough, or that's how I feel, because I accepted that this is normal and that's okay, and I stopped going to my GP. So my diagnosis time is really a long time from first suffering. Some people are going to the GP and still fighting, and it's still taking 7 or 8 years for them to get diagnosed. So it's different reasons why it takes that long, but it does still take a long time for one reason or another.
I started my journey just with my GP. I'm still waiting for the referral in 2020, January 2020.
Like you said, Claire, the only true way to actually get a proper diagnosis is through the laparoscopy surgery, because you could go for the MRI and nothing show up, and you could go for surgery after that and there could be tons, you could be riddled with it, and it just depends on how the MRI is done, and because there's obviously the different contrasts and things that they can use for MRIs, and then there's different imaging techniques, and it just depends how deep it is, how obvious it is, if they've done the right technique, if they've used contrast or not, whether it even shows up.
Yeah, I think that's one of the things, and I'm not a medical professional, I've just lived through this, but I think that's one of the most important things for people who are going through the process of suspected endometriosis and getting diagnosed. It's the importance of making sure that whoever is doing that scan is fully aware of what you're having that scan for, what they're looking for, so that they get the imaging right.
The next question, I know you guys aren't medical professionals, but can endo just go around its own all of a sudden? Like, can someone have endometriosis and then it be gone? And that, I guess, to both of you, because you both got diagnosed with this. So.
No, I don't believe so from my experience. Again, I'm not, as you said, I'm not a medical professional. I don't believe so, because essentially the pain that you get from the endometriosis is the fact that that the lining of the womb has gone outside of the womb. Now, essentially that would come away and release through your normal cycle. When it's gone the other way and it's stuck on the outside of the womb, it's essentially floating around in your body or attaching itself to your organs. There is no outlet for it to disappear through when it breaks away, and that's where a lot of the pain comes from, because it still breaks away, because it has that tissue and that characteristic, but there's nowhere for it to release, so it just breaks away into your body and then floats around, grows, reattaches, and then you go on to your next cycle and it does the same thing again. Yeah,
I just find it scary that it's so common. It's something that can cause so much devastation to a body in so many different ways. Like, it's not clear cut. It's not just, and this comes back to issues with diagnosis and things, but it's just so not clear cut with endo, because it can cause issues anywhere in your body, anywhere abdominal in your body. It can cause, or thoracic, it can cause issues anywhere. And the symptoms can be so vague because of that, because there's so many different types of endometriosis. But when you think about it, it's really scary that this tissue can just go wild in your body without actually getting diagnosed for potentially coming up to a decade.
Yeah, it really can go anywhere. There are, reports of extreme cases where it has attacked other areas of people's bodies, causes them problems with their lungs. It can get anywhere.
I think there's even been, I think I read a report somewhere, I could be completely making this up, so take this with a grain of salt, but I believe I read something somewhere about remnants of the endometrial tissue or lining being found in the brain as well.
Yeah, I read the same thing.
Yeah, so I believe that's also a possibility.
I watch medical programs. I love medical programs. Now, this one was a fictional medical program, but I don't know, I'm pretty sure it was on the brain, and they couldn't figure out why the brain kept bleeding when there was no bleed in there, and it turned out to be endometriosis. And I was like, what?
I believe it's because it can end up in blood vessels and things, and can end up getting carried around the body. Again, take this with a pinch of salt, because it's basing off something I read potentially a year and a half, 2 years ago. But I believe it's to do with being able to travel in the blood flow and blood supply and things, and it can just migrate.
Wild, isn't it? Such an unpredictable disease.
So where are you now then, Claire, in terms of, obviously you've still got to go for your review and things in a few months' time, but where are you now, pain-wise, health-wise? How are you feeling in yourself, and what do you feel in terms of your next steps?
It's very hit and miss, pain-wise. It's nothing that's not manageable, but about 8 or 12 months ago, my symptoms did start to return. Pain has started to return, funnily enough, I'm sat a little bit uncomfortably right now. I'll be fine in maybe another 12 hours, it'll go away and everything will be fine, and then I'll be fine for probably another 3 or 4 weeks. But my symptoms are returning, which for me is concerning. Again, not a medical professional, but the injections, the treatment that I'm on that basically shuts down your ovaries is the strongest treatment that they can give you to prevent it from coming back or slow it down. But obviously it's not a long-term solution. And if it is coming back whilst I'm on the strongest treatment that you could possibly have, what's going to happen when I come off that treatment? And these are things that are always in the back of your mind. It's not like you're looking for it still to be there. I'd love nothing more than for somebody to find a cure for it and never have to suffer again, and no other women have to suffer with it.
Mm-hmm.
But the reality of the situation is that's not the case, and people do have to suffer with it, and there isn't a cure. So I have to wait until April. I have another appointment in April, and we will see what they say then. They may want to put me on some slightly different treatment, so that they give me a rest from these injections, because they are quite, invasive. Similarly to what you were saying, Hayley, in your podcast, you get it's not a small needle. it's quite the javelin. And you do get scarring from it. You get puncture marks, you get bruising. Sometimes it's better than others because they have to do it in different locations on different sides, and sometimes you'll hit a vein, not a vein, but you'll hit something that makes it really bleed, and other times you won't bleed at all. Sometimes it'll really bruise, other times it won't bruise at all. It's very hit and miss, but there are side effects to that as well.
Yeah. And how are you feeling about coming off the injections? Because obviously I know you mentioned that these are the strongest, basically the strongest type of medication you can have, because it's shutting everything down, and it's preventing estrogen, which encourages the growth of tissue. How are you mentally feeling about coming off that and potentially being on either a weaker treatment or nothing at all for a while?
The other treatment that they've offered me is to have the coil fitted, which I'm not particularly comfortable with. I haven't had it before, so it's not like I have some idea of what that's put me through. And you hear a lot of scare stories, and to be fair, I heard a lot of scare stories of people that was having the injection treatment that I'm having. It's been an absolute godsend for me, and the coil could be very similar, but I'm not really comfortable about that. I think my preferred option would be to just go natural and see what effect that has on my body. And if it starts to come back and comes back with a vengeance, then that's the point. I need to have the conversation with the surgeon and the consultant again, and say, right, what are the options? And I've spoken to my family, I've spoken to friends about considering my options and considering that the removal and the hysterectomy, because essentially, as I said, if you get pregnant and then it's going to come back, and then you've got to try and look after a child while suffering with this condition, I can't even begin to imagine what that would be like. And if it turns out that I come off the treatment to try and get pregnant and it comes back so severely within 12 months that I then need to go back on treatment or have further surgery, it's just going to be a vicious cycle of having laparoscopy after laparoscopy and having it removed. And actually, the best option is, rather than going under the knife constantly, year after year after year, or go under the knife, then have 3 years worth of injections and then come off it for a year and go under the knife again, maybe the best option is just to resign yourself to the fact. Because what kind of life, I understand completely that they're trying to preserve my ovaries and my womb so that I can have that family that I would want to have, but what kind of life are you going to have, and what kind of life is that child going to have if mum's doubled over in pain all the time, or you're suffering because you can't care for the child at such an early stage because you're in pain, because your endometriosis is flaring back up and kicking back in.
Yeah.
So it's a serious consideration.
Yeah.
That I think most people, I can't speak for everybody, but I think most people that have got endometriosis have to sit down and have that think. And that is a really tough situation to even just play out in your head.
It is, because at the end of the day, you're taking up an organ, you're voluntarily taking an organ out of your body, and you're not actually 100% guaranteed it's going to fix things, but it's your best chance. It's your best shot that you have, but you have to sacrifice so much.
And I think that's one of the frustrating things with the condition, and why we need to raise awareness. We need to get more research. We need to remove this stigma about talking about women's health, because there are so many unknowns. Will a laparoscopy remove it all? We don't know until we go in there. We can't tell you what the result's going to be, whether we can get rid of it. Will an hysterectomy reduce your symptoms and give you a better quality of life? Well, we don't know until we go and take it out and try and see if it comes back. Will I be able to have a child and have a family? Because we're talking about all this stuff about fertility and having a family, and I might not even be able to. Well, we don't know actually until you try and have a baby, whether or not you can have a baby. And that is where the research needs to come in, the awareness needs to come in, and the funding needs to come into women's health, because we have to better our understanding of it. We have to try and remove some of those we don't knows.
Yeah, completely agree.
It's all a lot of what if, isn't it?
Yeah.
What if? That's the worst thing. You're out of control of your condition. You're out of control of what's going to happen next. And again, that has another effect of mental illness. So it's a lot. There's a lot going on with this condition, more than just the condition itself.
Yeah,
absolutely. I mean, we've come so far just in the last 12 to 18 months of raising awareness of endometriosis. So, when I was diagnosed properly 3 years ago, many people that I had to speak about this with, didn't know what it was. And I will speak to anybody about it, just because if one more person knows what this condition is, and that somebody could be suffering with it, or the symptoms of it, and I will speak to men, I will speak to women, I will speak to anybody who will listen.
Yeah.
Because for every one person that knows the signs, they could help somebody who doesn't know about endometriosis. Any guy out there that knows the symptoms, can see some of the effects, could easily tell somebody, a lady who doesn't know what's going on with her, that's an option that they need to explore.
And that's a really good point with educating men too, because yes, it's women or those who identify as assigned female at birth that do go through those symptoms and that pain, but educating men about what to look out for too, because they can spot things, and like you said, they could even just educate other members of their family who are female about what to look out for, and what because they maybe pick up on something else that they don't, because like you said, we ourselves end up just becoming, that's our new normal. We just assume that's how we are, whereas somebody as an outsider might see those things better than we can.
Yeah,
absolutely. And I'd heard the word before, January 2020. Then I met Hayley and another lady with endo, and they spoke about it, and I'm like, wait, that's what I'm being tested for. And then all of a sudden I'm seeing Amy Schumer talking about it on Instagram, and I see someone else, and then I sent Hayley a link the other day, or from a screenshot for another lady talking about it, and it's becoming the thing is, the problem is that just with so many conditions, there is a TMI, or there is a layer which you're not meant to talk about. So it starts with the women's reproductive organs. Oh gosh, no, don't want to hear that, la 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 la. Do you know what I mean? It's the same with bowel cancer. You know, you have to talk about your bowel movements. So, oh God, no, don't want to hear that. Oh, la, la, la. And that's the stigma we need to get past, because once we get past that, the raising awareness for so many conditions like endometriosis is just gonna just fly. So many people don't want to talk about their periods and how heavy it is, even with a doctor. Oh gosh, no, can't do that, you know. And I understand that it's been a taboo for so long. Then once we can lift the taboos of the whole entire body, we all have our bodies. We all have the same organs. Yes, some of us have had bit parts removed and there's a little bit less, but we all started out with the same basics, you know. And once we can start lifting taboos, that's the one thing we definitely need to aim for. Things like endometriosis is going to be talked about so much more. When Amy Schumer spoke about it for the first time, she kind of gave the speech of, I know some of you are not going to hear this, and we know we have taboos. Why is that going to be the start?
Yeah.
Why can it not just be, hand up, I have endometriosis and this is what it is?
And that is kind of, I'm glad that other people are doing it, and I kind of, within my community and people that I know at work, outside of work, if I socialise with people, I'm kind of on a bit of a one-woman crusade within my immediate contacts to make them aware of it. But you're absolutely right, Ria, because when I speak to my male friends about it, I do it with a disclaimer at the beginning. When they say, well, what were you in hospital for? What did you have surgery for? Okay, we can talk about this, and I will talk about anything that you want. You can ask me anything about it. But just so you know, I was in the women's hospital, and it is to do with endometriosis. And then they go, what's that? And I say, well, this is where it gets a little bit graphic. But it comes naturally with that disclaimer.
Mm-hmm.
The worst thing for me was, I was told previously, don't talk about it. Don't talk about it. Don't talk about it. People will think it's an excuse. People will, you know, use it to say this is why she's not doing this or not doing that or other things. You really probably shouldn't talk about that. And my response was, anybody that asks me about it and anybody that will listen will hear my story.
Right.
Don't try and stifle my voice.
That's so right. That's how it should be. When I started my lives, I disclaimed everything.
Yeah.
As you know now, I disclaimer nothing. I learned to no longer taboo, and you should learn to not taboo, and everyone should learn to not taboo, because it shouldn't be that way anymore. Come on, it's 2022. Why are we still doing it? We did it in the 80s and the 90s. Come on, let's drop that. Let's talk about how bad our poop smells and how heavy our periods are and how painful sex is. And you know, if it's happening, it's happening. It's real. It's something that people are suffering with, not just from endometriosis. You know, there's other conditions that people suffer with their uterus or with their penis. It's normal.
Yeah. Everyone pisses and shits. Half the population is born with a vagina, half the population is born with a penis.
Yep.
We all have a body, and we shouldn't just be able to talk about the parts you can see. The parts that you can't see are also parts of our body. Just because we cover them up doesn't mean they're not there.
Exactly. And 99.9% are sexually active at the right age. We put that in there. But there is some parts of the population who just, it's not for them. That's why I put the percentage in. But so why talking about sex why is that taboo?
Yeah.
Why can't we say it hurts? I bleed. You know, I want to shove an ice pole up there afterwards because the pain's so bad. It is that's the funny thing, and it should be laughed about. You know, why can't we laugh about it?
Yeah.
But it's real. Why can't we be real?
Yeah. And it's even, I know this is totally off topic, but women, when you're in a period, you have to hide a pad or a tampon, you have to sneak it in, you have to hide. Why can't we just walk to the bathroom with a pad in our hands, wave it in the air if we so desire?
Off to check my pad. Hello.
I'm on my period.
Not pregnant.
Why do we have to hide that?
It is bad. It's like same with condoms though, isn't it, for boys? They go into the pharmacy and they're like, So then they end up going to the pub toilet where it might not fit properly and it might slip off and they might accidentally get the person pregnant. Because there's so much things that come with taboos. Just that simple thing, like going to get the right size from the right place, but going for something else. I know it's happened. I know somebody it actually happened to. It's too big for them, and it came off and got stuck in her. She had to go to hospital to get it out. But why was that taboo? Why could he not march straight in there and go, I'm sexually active, I want something to make me safe? Good on you. Make yourself safe.
Yeah.
Why is that taboo? Why is that embarrassing?
Yeah,
definitely.
Things need to change in this world. They really do. That's definitely one of them.
I think I've asked everything that I wanted to ask. I have learned so much more about endo tonight than I thought like I would, but it's blown me away. So thank you very much, Rhea. I don't know about you if you have anything else.
I'm still flabbergasted by how much I've absorbed tonight. The good and the bad, and just downright shocking. But it's been beyond educational, and you've done it in such a way that it was clear and concise, and I think everybody will understand everything you have said tonight, and for that I thank you. I really do.
Yeah, thank you very much. And it's nice to hear, just from my selfish point of view, it's just so nice to hear somebody else has a similar story with their condition. And whilst there are similarities, there are also still differences, and it was those differences that are going to help educate people in different ways. And this is so important for what we're trying to do with the podcast, is, as we've always said, is no two stories are the same. And yeah, there were similarities, but there were also a lot of differences and a lot of things to be learned from another individual story. So yeah, absolutely brilliant. Thank you very much. So before we do part, we would like to give you the opportunity to mention a charity of your choosing that if people so wish to go and have a look at, they can do. Any links that you may have found, and just anything else you'd like to share.
Yeah, so the charity that I wanted to shout out was Endometriosis UK. They are one of the biggest, if not the biggest charity in the UK. They help so many people, not just through their charitable work, but even just go and have a look at their Facebook page, their social media pages. It has so much information on there, all of it educational, to just help you recognise, if we can get one more person that didn't know about endometriosis, understanding the signs, understanding the symptoms, spotting it in themselves or anybody else, and bring down that time, that long lead time to get a diagnosis and ultimately on the road to a better lifestyle, then we've done our job today. So Endometriosis UK.
Absolutely. And that will be listed on the website and below on YouTube as well. But yeah, I think thank you again for having joined us. It's been great to sit down and speak with you.
Yeah,
take care of yourself. Please keep us up to date as well on your journey, because you've got so much coming up with you coming off the education and stuff like that. We'll be so interested to hear how that goes, and maybe bring you in at a later date and have you maybe update the followers on how you're doing and what actually happened once you came off this medication.
Definitely.
I'd love to. Thank you for having me, ladies. It's been an absolute pleasure. I've really enjoyed it. Hopefully we'll have some developments, and I'll come back and give you another update.
Wonderful. We appreciate that. You take care of yourself.
You too.
Thank you. Speak to you soon, Claire.
Thank you.
Bye. I loved her.
Oh, that was a breath of fresh air, wasn't it?
I wish I didn't have to put my feet up, because I would have just carried on.
I know. Been chatting all night. It was brilliant. It was really brilliant, and so nice to hear it from another perspective. For me, it was really nice.
Do you know what? Even though the story is the same, it sounded completely different to me, if that makes sense, because the journey for diagnosis was still different. And that's the one thing we've been trying to do with this, is to get people with the same conditions on, to show that no matter if you have the same condition, there's so much that's so different about it, the journey to diagnosis and the treatment and everything else. And with this podcast today, I feel we've done that.
Yeah, it's so true, because we can all only tell our own stories through our own eyes. We can, you know, what I see and what I felt could be different from what Claire saw and what Claire felt. And that's how you get two completely different perspectives. And it's so refreshing to hear a different side to a kind of similar story. And it's one I can relate to, but it's also one I can learn from, because she sees things differently to how I have.
Absolutely. And her answers were so clear and it's concise, and she remembers things clearly and was able to give great knowledge. I think that's so important.
Mm-hmm.
So important when you're raising awareness. And that's what people loved about your podcast, is how clear and concise you were, how much you knew, and how well you put it out there. And so now we have these two amazing podcasts about the same condition that people can relate to, even though they haven't got it. So imagine how those who have got it are going to feel now, having the both of your stories out there and feeling a bit from each of you and going, okay, you know, I don't feel so alone no more.
Yeah.
I can't wait to have more podcasts where we're listening to another story of the same condition again, because as we noticed tonight, it just draws you in and you can't help but just listen.
It does. I know, it was brilliant.
As always, from each podcast, we like to give a bit of a spoonful of knowledge. And from Claire tonight, she said something that's like super important that just stuck with us. And that was, even if you just have one bad period, go and seek help before it becomes your normal and you just live with it and you just don't think that anything's wrong because this is what you've dealt with for so long. So one bad period, go and speak to your doctor and don't drop the ball on it. If you continue to have them thereafter, keep going back to your doctor, because having horrendously bad periods is not normal, as Haley can confirm.
Yeah, and we can apply that to other conditions too. You know, if you have maybe prolonged bad diarrhea, don't write it off as this is just how you are. If you are having problems with your stomach, don't just write it off as, oh, this is just who I am. If something is out of normal.
Coughing for too long. I actually seen a notice in the pharmacy on Monday, if you've had a cough for 3 weeks or more, to seek medical advice.
Yeah.
It's, like you said, Haley, it can be put with any illness. If you have anything that is prolonged, goes on for a while, and you think, oh, I'm just sniffling, oh, I'm just coughing, oh, I'm just breaking wind. You know, everybody breaks wind, but if your wind is smelling horrifically bad, that is not normal. Don't let it be your normal. Seek medical advice.
Definitely.
But with that said, I think that's us done for today.
It is indeed, yeah. So thank you again to Claire. We had a brilliant time tonight, and yeah, we look forward to seeing you guys in a couple of weeks.
But for now, that's a bye from me.
It's bye from me.
Bye.